this next part of the presentation, I'm going to deal with the clinical features in the context of our understanding of central pathological mechanisms that are occurring in fibromyalgia. Now we'll start off looking at the ACR criteria developed for the diagnosis of fibromyalgia, and in it there are three conditions. In this presentation, in this next part of the presentation, I'm going to deal with the clinical features of fibromyalgia with reference to our understanding of central pain and other central mechanisms that are probably involved in the genesis of the disease. So look at the American College of Rheumatology criteria for fibromyalgia. There are three conditions in it. Here you can see in the first one there's widespread pain, and it gives a score, and I'll look at the scoring mechanisms in shortly. And then there's symptom severity, and again it's given a score from the scale, and it can be high pain, low symptom severity, or low pain, high symptom severity, and the cutoff will define most patients, not all, with fibromyalgia. Symptoms have to be present for at least 3 months at a similar level, and there is an exclusion, like with many diagnostic criteria, that the patient does not have another disorder that can account for their symptoms. So if we look at the widespread pain index, you see that we can score the presence of pain over the past week in up to 19 areas, and one simply adds those areas and gets a total possible score of 19. The symptom severity scale is made up of two components. First of all, the generalized symptoms, and then the physician assessment of somatic symptoms. So the generalized symptoms of fatigue, waking unrefreshed, and cognitive symptoms are each scored for the past week as no problems, up to a maximum score of 3 for very severe for each of these symptoms, giving a total possible maximum score of 9. And this is then added to a possible maximum score of 3 on the judgment of the physician with regard to the patient's somatic symptoms over the previous week, either no symptoms right up to very severe. These two scales are added to give the symptom severity score, and then those two scores are put together to give some numeric value with regard to the fibromyalgia and with regard to the patient's fulfillment of criteria. Let's now think a little bit further about central pain and pain itself. Pain in the CNS is modulated and integrated at many levels. There's cortical influences, limbic, midbrain, medullary sites, and autonomic regulation. So, and all these have a positive or negative influence on the perception, the reaction, the emotional content, the memory, their behavior with regard to pain. And so pain is not as simple as we understand from our experience of nociceptive pain, where you have a trauma, receive a pain, it heals, and things go away. There are other influences, and of course you see that in our own personal experience, that two people with the same perceived noxious stimulus react in some very different ways to the pain in terms of severity and reaction and persistence. So personal experience, emotional state, societal beliefs, genetic factors, and familial factors all help to explain the variability in pain. And in fibromyalgia, they probably also help to explain the persistence of the pain in the absence of, I suppose, a somatic abnormality. So one has dysfunctions of modulatory pathways. There's reduced inhibition, enhanced facilitation of pain, and as a result there is enhanced pain. Now, in addition to this increased facilitation and reduced inhibition, there's also altered threshold for pain in these patients with fibromyalgia, and they experience pain at lower thresholds. This is an organic disease. There are known abnormalities definable in these patients that are different from normal. So they have abnormal CSF transmitter levels, they have abnormal functional MRIs, all going towards confirming the presence of a real organic disease that is behind these abnormalities. Sorry if I just flick through here. Now, looking at the non-somatic symptoms, there are many. Pain, poor energy or fatigue, stiffness, and the stiffness is different to what one sees in patients with inflammatory or arthritic diseases. There is poor quality and sometimes poor quantity of sleep. Patients have mood disorders with depression and anxiety. They complain of memory problems. They have an achiness or increased tenderness to touch. And this was the basis for the previous scoring system for defining fibromyalgia, but this has been set aside now. The patients complain of balance problems and sensitivity to other stimuli, other sensations like loud noises, bright lights, odors, and cold. So the patients have not only pain, but they also have a number of other different abnormalities that go along with the pain. Now look at the somatic symptoms, and there are myriad. You can take nearly all the symptoms, and I will go through all of the systems just to illustrate what does happen and what one can see. Respiratory system, you can see chest pain, shortness of breath, or wheezing. Now these patients complain of shortness of breath. Their investigations with regard to, say, bronchospasm or poor pulmonary function will all be normal, yet they have a perception of shortness of breath. And again, this is probably an abnormal sensory input, just in a parallel way to the pain. And similarly with dry mouth, oral ulcers, loss or change of taste, diarrhea, nausea, loss of appetite, vomiting, heartburn. Irritable bowel syndrome is a frequent preceding diagnosis in these patients, constipation, and then abdominal cramps or pain in the upper abdomen. In the bladder, patients have symptoms that suggest cystitis, and they're often labeled as having interstitial cystitis or cystitis not related to an infection. But they may again have a story of repeated bladder infections. Though they have repeated symptoms of an infection, they often don't have bacterial infections most of the time. And then in central and the CNS, they have fatigue or tiredness, thinking or remembering problems, as we've discussed, depression, insomnia, headache, seizures, numbness and tingling, dizziness, nervousness, and fever. And then in the other systems, they have kind of tinnitus, hearing difficulty, muscle pain, muscle weakness, and hair loss, itching, Raynaud's phenomenon, rash, hives, sun sensitivity, and easy bruising. So clearly, not all patients have all symptoms. Many patients have a number of different systems, and a number of different systems are involved. And sometimes it's that pattern, along with the pain, that will lead you to this diagnosis. And after taking a history, you may have a lot of evidence to suggest this. Physical examination is required and is often normal apart from some tenderness in areas. And investigations that include blood count, ESR, liver function tests, and renal function tests, biochemistry, are all normal. And they should be normal and reassuring, and them together with these other features certainly go a long way towards making the diagnosis of fibromyalgia and avoiding a lot of unnecessary investigation. So in the last of these 3 short videos, I'm going to deal with the management of fibromyalgia. You can click on any one of these 3 titles to get you to the video related to those titles.